If you didn't catch our recent CAA 2020 Interactive Ideas Board webinar in partnership with Trapeze, here's what you missed.
My name's David Waters, and I'm the Chief Executive of the Council of Ambulance Authorities. And it's with great pleasure I bring to you today a hot topic, COVID-19.
Raylene Hartman, Chief Psychologist at New South Wales Ambulance, took us through their system to manage the stress of COVID-19 on their workforce.
New South Wales Ambulance's approach to supporting staff during this time has focused on easy access to customised, relevant and reliable information, advice and support. This has been consistent with our overall staff health strategy to promote positive wellbeing and reduce barriers to help seeking when staff need additional assistance or support.
Dr Ng Yih Yhg, Chief Medical Officer at the Ministry of Home Affairs in Singapore, gave insights into how they're handling the pandemic.
This is a summary table from the Ministry of Health. So far, we've had 56,000 cases, but I think what is interesting is that over the last almost 2 months, I think we've not had any cases in the ICU. Total number of deaths are 27.
We spoke with Executive Director of Clinical Operations for Ambulance Victoria, Mick Stevenson, about the changes they've made during Victoria's COVID response and second wave.
Established a specific COVID-19 response plan, which is very much based around triggers of reduced supply in terms of our staff, and we've modelled up to a 30% reduction in staff and also an increase in demand in workload. Produced a series of expert videos very early on, so infectious diseases, physicians, infection control consultants and so on. We built support hubs at hospitals and established sharing and changing facilities. As we've been able to build an internal contact tracing team that we brought forward, recruitment of 120 staff, that's held us in good stead. We've been running between 20 and 40 additional resources a day. Engaged partners as we have access to under the Emergency Management Manual Victoria, Lifesaving Victoria, the SES, for example, the Australian Defence Forces.
And James Weatherall, the Managing Director of Emergency Services at Trapeze, showed how technology can assist to boost performance, safety and patient outcomes.
Of course, I would say technology is the answer. The people-focused technology provides the ability to gather, process and make decisions. Simplification and trust in the methods is key.
We gave away prizes.
It gives me great pleasure to announce that Byron Williams, Clinical Support Officer, has come up with an idea that resonated with us. What Byron talks about, that there is a significant increase in vulnerable patients during COVID. So non-accidental injuries, elder neglect and family harm. And this is being seen by ambulance officers, often on a daily basis, particularly during lockdown. So Byron's suggestion was that we have a sector of specially trained ambulance officers working on the clinical desk assigned to managing vulnerable patients by allowing operational crews to call in and get advice and referral through these trained people so the patient can get into the appropriate agency or get the appropriate care, such as an elder abuse organisation or child abuse and families, social work, for example. So congratulations, Byron, and you have won yourself registration to the CAA Conference in 2021 in Sydney,
with the second winner announced on social media. Join us for our next webinar on the 22nd of September for Sustainability and Ambulance Victoria with Sally Mangan.